After the birth of each of my children, two of them, I got into more and more chronic disease like fibromyalgia, brain fog, chronic pain, neuropathy. And at the age of 36, I went into early full-blown menopause. I was told by my doctors that I was just getting older. And I was like, dude, I'm 36, I'm not 86. Later on, I discovered through my own digging and searching that I actually ended up diagnosing myself with autoimmune disease like Hashimoto's, which is an autoimmune attack against my thyroid. And later to discover I have multiple different autoimmune targets, like I have mixed connective tissue disorder. That's why a lot of my joints, nerves, and my gut and intestines are affected. In that journey through going through hormonal crisis, through tons of issues with autoimmune disease, dealing with lots of autoimmune attack against my nerves and my nervous system. I dealt with a lot of POTS, dysautonomia type symptoms as well. So I've been through the gamut. And I also work with people with all those symptoms or diagnoses. And I also work with people who have a lot of allergic related symptoms like mast cell and histamine intolerance. If you don't know what it is, type in chat mast cell or histamine intolerance, because I actually have a whole training series I did around mast cell and histamine intolerance. Last week we went through all the different types of food trauma. One of the main things you guys told me was that your doctors was a major cause of it. So I want to explain to you from a doctor's perspective to you why doctors believe these lies. They're not trying to lie to you. We are good-hearted individuals that go in wanting to heal and help people. But with the best of healing, we are trained in a medical system, in a learning system, in an educational system that is broken. In my 28 years experience as a medical doctor and in training doctors to learn root cause medicine, one of the things that is really clear is that the way that doctors are trained is for us to be sorters. We're trained to actually be really quickly in a very quick period of time to write a prescription, order a test, or send you to a specialist as quickly as possible. As a primary care provider, family medicine doctor, I'm trained to sort as quickly as possible. That's what we're really trained to do. 4 years of medical school training, and then 3 years of training to be a family medicine physician. That's 7 years of medical school and licensure training. How long, how many hours or days or weeks do you think I spent learning about the role of food and how it can cause symptoms or disease? 20 minutes. I'm smiling and laughing about it only because I think it's a travesty and I think it's shocking. For me, this is how they still currently train physicians at the top medical schools around the world. You wonder why, if I only received, let's say, 20 minutes of training around food, the only extra training I got after the 20 minutes was when I got diagnosed with gestational diabetes during my first pregnancy. And I had a one-time visit with a dietitian to learn about gestational diabetes. And that was another 30, maybe 45 minutes. And that's only because I was diagnosed with something that was food related. We are not trained as doctors to understand that food really matters. Last week, we talked about how food and food trauma is really linked. How many of you guys have been told by your doctors that if it isn't immediately upon the consumption of food and it's related to your gut, then it's not related to food? One of the top lies, let's start with lie number one. Lie number one is that your health symptoms have nothing to do with food. I know last week we were talking to Carissa, I think, about neuropathy, nerve pain. She was told that had nothing to do with food. One of the reasons why don't doctors believe, let's say the symptom is pain or neuropathy, which is pain in your nerves. It's not necessarily time-wise linked to the consumption of food in a very short time frame. It's not like I ate this peanut butter and literally 2 minutes later or 20 minutes later, I get the nerve pain or the pain. That there's a delay. There's not an immediate attribution of the consumption with the effect. What if that result? And I'm going to tell you from my own experience, right? Food reactions can take sometimes minutes, most of the time can take hours to days. If let's say you have nerve pain and it really flares 2 to 4 days after you consume broccoli and you eat broccoli 2 to 3 times a week, how do you know that there's any relationship with it? Can food reactions cause nerve pain? And POTS, which is postural orthostatic tachycardia syndrome, it's actually related. He says it's an immune attack against your nervous system. I'm the only physician that's saying that. You know why? Because I work with POTS, dysautonomia, and long haul for breakfast. Give me a hard problem for lunch and dinner. Issue of causation is there, meaning like food itself is causing a symptom. In diagnoses like POTS, for example, people don't realize not only can food cause issues, if it's an autoimmune attack against the nervous system, people say, oh, there's no connection between autoimmune attack and POTS, and that you should go see the cardiologist. Wrong. There's a problem with causation here, everybody, meaning that the real cause of these problems and with the diagnosis of the symptom, the connection is not there in the training for doctors. In regular conventional medical training, when someone comes to you, let's say with nerve pain or with POTS, we're only trained on what prescription or blood work or referral we need to give you. To figure out the root cause that's underlying your chronic disease or symptom, click the link above or below this video and register for the training. We'll see you there.